Hi everyone. So the topic of today's presentation is about assessment criteria. So what I want to do is, although I believe assessment criteria is quite self-explanatory, um, you can find assessment criteria at two places. First of all, the easiest way to find assessment criteria is, of course, under the module assessment criteria, which you can easily find out in your unit, whichever unit you are enrolled in. So you just go to the table of contents, and assessment criteria will have a separate module. In that separate module, you are going to have details of assessment criteria for assignment 1 to assignment 4. And you can basically just scroll through assignment 1, part 1 criteria, then assignment 1, part 2 criteria, assignment 2, part 1, part 2, assignment 3, and assignment 4. So that's where the assignment criteria lives. You can also find assignment criteria from the unit overview, because in unit overview you have the unit outline, which, by the way, you can also access from the main page whenever you enter in assessment, like your unit. The first page of your unit will also have unit outline here. It will separately open it as a new tab, so it's the file. You can save it, print it, or keep it. Apart from accessing assessment criteria that I'm pretty sure that you guys are now well aware of, let's talk about the assessment criteria a little bit in more detail. So as you know, there are 4 assignment tasks in this unit, and subsequent 7 to 1 to 7 to 6, all 6 unit. And this file basically just have an individual task criteria of particular assignment. So if your assignment have two part 1 and part 2, then there's a separate criteria. Just want to identify that task 1 and task 2 will be judged on the same criteria, because the criteria is focused around the actual discussion post that you will be posting um, for task 1 and task 2. This, which is like the fail criteria or less than 50%, is the worst case scenario, and even worse than that, if you have even worse response, then within that you'll get less than 50, say 40, 30, 20% marks. While if you go towards the left, this is raising the standard of your response as you go from pass to credit to distinction and to high distinction. An important determination that assessor have to make is the allocation within assignment criteria. So for example, not all of the students ask me this question, but some of them who really go into details of assessment have actually asked me this question. So I'm explaining it just now. That you can see that, for example, HD got margin from 80 to 100. So obviously it's a there's always a room of improvement. So probably one or two student have in the past secure 90 or above. But just to give you an idea that within a criteria, there's always some room to move up and down to that criteria. So some of the students who score HD or who have HD quality may have an HD quality of 80 marks or 81% or 82%. But as the quality goes higher, we assign marks. Usually people in HD don't have that question for me. So let's focus on DN, credit, and pass criteria. So how do we fluctuate between distinctions? So for example, why somebody gets 70 as a distinction versus somebody you get 79 or 78. So if all part of your criterion, a particular criterion like this, answerable question in PICO, and this is one criterion. So if you are meeting it fully, then you are looking at scoring 75 or above. If you are satisfying part of the criteria of distinction within one particular criterion and part of the criteria of credit, then most likely we favor you and give you a bit towards distinction, unless your quality is further down the line, which you'll qualify for this one. And in that case, we'll probably give you a distinction, but not a high distinction towards, or high distinction actually have a term. So not towards a greater part of distinction or a higher end of distinction, rather the lower end of distinction if you are in between distinction and credit. Same apply to credit and pass, and same apply to pass and fail. So we usually give benefit of doubt as they give in cricket. If you are more towards, or at least 50% towards pass instead of towards fail, so we actually favor towards the left, especially in this section. So if you are failing a task, then you basically are not satisfying. So the reason we fail a particular assignment, or reason anybody fail a particular assignment at a university level, is that we are afraid of that student not meeting our intended learning objective at large, because after passing this, you are gaining a qualification as a postgraduate level in this area. So we need to be very sure about that, that you are meeting the minimum requirement of passing this unit. So having said that, so this thing applies to all the criterias, all the assignment, where how do we fluctuate between the criteria. Now, coming back to the individual criteria, assignment one, part one, task one and two, you'll have 4 grading across and a fail. Um, Assignment one, part two will have a 20%. So basically there's no allocation. It's all whole 10% for this and 10% for this. So it's out of total 20%. We don't have further division in the discussion post. But when you move to assignment one, part two, where you are supposed to do 3 small tasks, so answerable question and PICO, search strategy and quality assessment of selected references, and response to the problem with the referencing. So we have 20, 30, and 50% uh, for a reason, because the answerable question PICO should be very straightforward after doing some example, watching video, looking at your example cases, and also participating in discussion post. So you should be able to finish it in relatively less time compared to such a study and quality of selected references. And when you are going to write a response, basically you need to make inferences from your literature. So it's relative to how much time you will be spending on each part of the assignment, and that is why I've made it like that. The reason why discussion post only have 20% instead of 50-50 is because this is where you can get useful hint and formal feedback or formative evaluation from your colleague and from your tutor, so that you can perform better in that one. And that's why I left it at 80% and left leave this at 20%, so that you can learn from your first week and subsequent week to perform better in the final assessment. Same goes with assignment 2, where I have part 1 and part 2. So again it's 20%, so 10% for task 1, 10% for task 2, and then you have 30% and 70%, because 30% is about selecting the references and basically choosing best references, so that can answer your question. But in the response, you will not only be assessing the response to the problem, you're not only providing the response to your problem, but you're also using useful citation at the time of uh, place where you want to put an inference. Now, because both of them actually have referencing in there, so I also think that this part deserves a little bit more explanation. That's why I'm providing more explanation about this criteria. No specific reason. I don't really like assignment 2 than assignment 1. All of these assignments are equal to me. Let's discuss why these referencing have been used in two different criterion. So this is about you selecting the most appropriate references and the actual referencing of them. So following the referencing criteria, following the reference material, choosing good references, selecting up-to-date referencing, not relying on textbook or therapeutic guidelines. So this is about choosing your sources, choosing your references, and choosing and adhering to your referencing style. Now, this one is about actually appropriate referencing style, but at a much higher level where you are using these references to give a response to the problem, but you are citing the references in a seamless manner where they are appropriate to be cited. So, for example, if you are making a conclusion about a treatment, or if you're making a conclusion about an adverse drug reaction, or you're making a discussion about uh, a particular aspect of management, then you are using that reference that back up your claim, and you are citing it at an appropriate place, taking that information from the reference material and including it your answer. And that's why the exceptional response to the clinical problem based on the selected references, clearly providing comprehensive information from the selected studies to draw a conclusion for the case in a seamless manner, integrating, this is where you are putting the references, integrating appropriate citation that are free from any irrelevant discussion. So for example, if you're quoting like, 5 or 6 references for a discussion, it means what? Like, are all those 5 studies concluding the same? What, like how you are providing that specific information about it. And I think a bit of feedback like this will be provided in your discussion section in assignment 2 part 1. Assignment 3 in principle is exactly the same criteria as assignment 2, because there will be just one case and 4 questions instead of having a smaller case and specific questions. So you will also have a specific question for that. So it's completely applicable as it was applicable in the first one or in the second assignment. Assignment 4 deserve a little bit more attention, because if you look at assignment 1, 2, and 3, they are very specific in terms of HD, distinction, credit, and pass as well as fail. But in this particular assignment, because it's a presentation, so I believe that I should not, like, I don't think that the way you have present your data or your presentation and your clinical topic should go more than 50%. In fact, I believe that it should be 40% only. The way you have developed your presentation, the reference material, the amount of research that has gone into your presentation, and how you have structured and um, develop your contents is really important, because that's where you are providing information, and that's why it's 60%. Now in this one, instead of you meeting individual criteria, is the collective um, meeting of all the criteria. So all these 5 criteria, if you exceeds the expectation here on all of them, you are in HD. If you are just meeting the expectations uh, quite nicely on most aspect, you are into criterion, all the criterion, you are into distinction level. If you are meeting the expectation on all criteria except one criterion, so one part is a bit loose, but most of it is pretty good, so you will get credit. But if you basically meet the expectation on at least 3 of them, then you will be pass in this task. Both of the criteria, if you meet at least 3 of the criteria, you will be pass. If you are not meeting 3 criteria, so if you are failing to meet expectation on more than 3 criteria, so you are unable to address at least 4 criteria, then definitely I think your work is pretty bad. So you should fail that particular task or assignment. Now, this is just a detail of all the assignment criteria and how we are going to assess things. A very important note about assessment. So I believe in objective criteria. I try to make criteria as objective as possible, and I also like to share the criteria from day one to my students, no matter which level I'm teaching. This is because I believe it's only fair for students to know beforehand that what is the assessment criteria for two reasons. First of all, they exactly know what they need to pass a particular task, but also they can have a self evaluation. So I'm suggesting that whenever you have finished a task, go back to an assessment criteria and try to assess yourself, because as a healthcare professional you need to self assess your progress. You need to self assess where you stand and ask yourself, am I a distinction, credit, pass, fail, or a high distinction student based on this task? And then you can see, okay, where you are lacking, and you can perhaps do more work in that section. It should be very easy because you are going to get some formative feedback on assignment 1 part 1 and assignment 2 part 2. So by the time you start doing your assignment 3, you should have a very good understanding of how to assess yourself and how to improve your work. Also, an important note about the sequential release of these assignment. I believe that the assignments are being released so that you focus on that particular aspect of the case. I know it's distance learning. It's very difficult to have a focus unless you are a very focused person. So it is important that you, at least we as a unit coordinator and you as a student, try your best to stay focused on different tasks as you progress through unit. And the only way to make it as achievable as I can is to release them sequentially. You'll still have access to all the cases, not the specific question for assignment 3, because I believe that you can, by the time you have assignment 1 and assignment 2, assignment 3 task will be released a little bit early compared to assignment 2 task being released and assignment 1 task being released, because I want you to first focus on discussion board, provided model answer, that you can have formative feedback. And by the time you are halfway through the unit, you should be able to further self-direct yourself, and then assignment 3, assignment 4 will be released sooner than assignment 1 and assignment 2 relatively, if you look at the deadlines of release as well as submission. So I hope you have a clear understanding of assessment criteria and how you are going to be assessed. And I hope this presentation will provide you useful insight to make sure that your submitted work is of highest quality. Thank you very much for watching.